My name is Pankaj Shah. I'm one of the endocrinologists at Mayo Clinic in Rochester, Minnesota, USA. I'm talking about diabetes in people who get transplanted with various organs like kidney, liver, lung, and heart. These people are at a higher risk of having diabetes and then even higher risk of developing new diabetes after getting the organ transplanted. This extra risk of diabetes and then diabetes itself poses an extra risk of heart disease, new kidney failure, and the related complications of diabetes. Even the organ failure happens more in people who have diabetes. These patients are in close contact with the transplant team, and we at Mayo Clinic are part of the transplant team and take care of their diabetes amongst other endocrine complications. It's a little tricky because many drugs, many medicines are not okay to use in a situation like theirs. But then there are many new options now that are helpful in controlling their blood glucoses. It appears to us that with good blood glucose control, they would have less complications, less rejections, and less need of anti-rejection medicines. Therefore, having an endocrinology team as a part of transplant team is critical, and that will help these patients have less complications from the transplant and diabetes. I'm talking also about the secondary diabetes caused by endocrinology conditions. These are exceedingly rare conditions, but to find these conditions and treat them is very gratifying, because this will not only help diabetes get better control, but also prevent other complications. For example, some people have Cushing syndrome caused by an adrenal tumor or a pituitary tumor. And this can cause diabetes to get worse, but can also cause osteoporosis and high blood pressure, increased risk of heart disease, increased risk of fractures. So when we see diabetes and the blood glucose is not very well controlled, despite reasonable medicines, and then there are some telltale features that there may be something else going on, looking for that, understanding that testing for these conditions are not straightforward, but minimal testing is absolutely indicated. If there is minimal testing, then these patients need to be referred to endocrinologists who have expertise in managing these conditions, because then the diabetes is much easier to control. For example, in acromegaly, if they are cured, the diabetes, which lasts between diabetes and high glucose, which is about 70% of people, goes down to as little as 30%. The blood pressure is better controlled. The risk of heart failure goes down. So the other conditions are Cushing syndrome, acromegaly, pheochromocytoma, somatostatin-producing tumor, glucagon-producing tumor, amongst other conditions that can cause so-called secondary diabetes. To identify them and treat them is gratifying, because diabetes is much easier to control when you identify and treat these conditions. Not only that, but the other complications are prevented as well. Thank you.